Good morning, beautiful people. This is Dr. Radialis from the Georgia office. Um, sorry. As some of you know, I see a lot of patients that are past 40. And yesterday I had a conversation with a 48-year-old that, history of no children and an AMH that was zero point 0.1. And she wanted to try. She was turned away from 3 different clinics, and she wanted to try to use her eggs. And we went through a very long conversation about all of her choices, and it's very important to understand. I like to call it being realistic, optimistic. Okay, so it's very important to understand that past 40, especially past 43, the easiest, fastest, cheapest way to a baby is actually donor eggs. Okay? It is not necessarily the only way. All right? And because that is the kind of the generalized, well known fact, a lot of clinics will push you. They won't even allow you to try with your own eggs. However, it's all about perspective. Okay, it's very important that as we are walking this path, we have a positive attitude, but also have realistic expectations. When you are past 40 with a very low AMH, especially lower than zero point 0.5, it might take you quite a bit of IVF cycles. We're talking about potentially 5, 6, I've seen it up to 10 cycles to get the golden egg. That, even within CNY, that we are the most affordable, it's still quite a bit of money. Okay. So it's very important that if you are in this category, you understand that starting off. And if that is what your heart desires, we are all here to serve you and help you in the best way possible to achieve that goal. Understanding that you are the underdog and you are fighting quite a few challenges. That doesn't mean that you can't be successful. That means that the path, the try along, like I like calling it, it's going to be a lot more gruesome. And all the way to my patient yesterday with 48 years old with an AMH of 0.1, IVF might not be her best choice either, because she might go through the whole stint cycle. Okay, she is going to potentially go through the IVF cycle for 0 to 1 egg, 0 to 1 embryo. So risk benefits and cost effectivity of that, I don't think it's necessarily a good thing. If that's, and we had this whole conversation, and if that is what she wants, and she wants to try on her own, nobody's going to stop her. But at the same time, I think that all of us, no matter what we are, we should be allowed to have an informed consent. And giving you all this information is allowing you to make informed decisions. So what can you do if you decide to take the hard road and be the pioneer as we unfold new paradigms in this world of ours? Well, you've heard me talk about priming. Priming, it means different things by different people. The concept is improving what you have to improve outcomes. So how about estrogen or ethinyl estradiol, progesterone, right before your cycle to desensitize the receptors? Go for low dose medication. It's going to have better results, especially for women past 40. Diet, get off the grains, wheat, corn, soy, oats, rice, nightshades, eggplant, tomatoes, peppers, peanuts, cashews, beans. Those are the most allergenic food products out there, okay? And you've heard Dr. Kills about all of these antigens in the surface and how they cause a lot of inflammation and trigger the immune system. So if you can go keto, what I tell my patients is I'd rather you have roots, okay? Potatoes, sweet potatoes, yuca or cassava, turnips, carrots, that you have pasta, all right? The least amount of insults to your body, the better chance of improvement you're going to have. And this is basic math. If you have your body reserve is 100 and your body spending 70% on keeping you alive and going through all these insults that um, you know, we go through, from the pollution to the stuff we put in our mouth to the stuff we put on our skin, you only have 30% for healing and rejuvenation. So something as simple as cleaning your diet, it's going to take insult out of your body. So that 100%, maybe by cleaning your diet and cleaning your environment, from cosmetic to lotions to everything else, how about goes to 30? That gives you 70% chance for rejuvenation and healing. And trust me, your body was designed to heal itself and to work optimally. And it wants to be young. It wants to be youthful. Okay. It is our birthright. So something as simple as that could be huge. Yesterday, I talked to this lady about PRP. What is that? It's being used for, a very long time in different areas. It's a lot more known now that when I started using it, but we can take your own growth factors and healing proteins and manipulate the healing pathways, such that injecting your uterus or injecting your ovaries might wake them up to try to heal themselves a little faster. I usually recommend series of that. So 1 to 3 treatments, one each month for 3 months. I think priming should be 1 to 3 months. Why? Because you didn't get here overnight. All right. And you want to be able to do this proactively and not wait to have a failed IVF to say, how can I fix this? How about we start working with the priming, optimize what you have, and then hopefully get the best results we can possibly have when you actually go through your fertility treatment, whatever path you choose. Okay. Awesome, Brooke. I'm rooting for you. I love when my 40 plus ladies, they're feisty and they're moving forward. It just gives me priceless pleasure to see when, like I said, we are breaking the paradigms of society. We are not old, decrepit, and go be a grandma. Absolutely not. That's why I created this group of being 40, fabulous, and fertile, right? So I hope that your second round, um, it's gonna be the winner. Okay. So going back to things that you can do, there's a lot of supplements out there as well to plug in to, for example, to help the mitochondria. That's kind of how the CoQ10 works. And CoQ10 has been studied mostly for heart issues because of the same mitochondrial deficiencies. So, and I tell patients, because I do run an anti-aging clinic, that anything that is used for anti-aging in the cosmetic world or in the sports medicine world can be applied to fertility, because whether it's your skin, this is epithelial tissue. Guess what? Your ovaries are epithelial tissue. So anything that is going to get away with this, age spots and wrinkles can be applied to your epithelium down there. And as a cosmetic gynecologist, I went to a seminar once that the motto of the seminar is, which face are you showing? So a lot of the techniques that are used on the skin are also used down there, even for cosmetic purposes. Okay. So I'm not familiar about C60. If it's one of those peptides that are being used out there, I know retinol is bad. I agree, especially if you take it by mouth. Yes, especially in the pregnancy thing. But I'm thinking of hyaluronic acid, PRP on the face, Vitamin C, right? We talk about vitamin C. Vitamin E and C are very, very important for the epithelial tissue. You do want to get a very clean source, food-based, okay? Just because of the way it happens in nature, and the complex of the vitamin is not an isolate. For example, ascorbic acid by itself is not really the complex vitamin C complex. Same thing as alpha tocopherol is not vitamin E, because they're actually a group of tocopherols and selenium that are crucial for that complex to work. So I always recommend supplements that are food-based, supplements that have a food buffer, in order to allow your body to be able to use the stuff that you're giving it, okay, without creating deficiency in other areas. Red light, blue light, yes, especially red light. There's a lot of research on red light therapy and how some of the effects that you might get on a superficial level go a little deeper. And infrared light to the pelvic area has been shown to cause anti-aging and fight oxidative damage. So I recommend that if you have the ability to get one of those things, you can do it 10 minutes every day to the pelvis, and that's going to help all of your female organs. Okay, now infrared sauna, you have to use it carefully because the heat factor, your reproductive organs don't really like heat, both for the boys and the girls. Okay, so if you can get a cold light therapy, what they call cold laser, then go ahead and get it and put it as part of your routine. And in this world, there's no magic pill, there's no magic intervention. Okay, I get this conversation with my stem cell patients that I take to Mexico. It's like, stem cells is like the new frontier in cell therapy, but it's not the cure-all either, especially as an isolate. So it's like those little bits, okay? This gives you 1 degree of improvement. This one gives you 5. This one gives you 2. And slowly, that balance is going to tilt to your favor. And boom, you're going to find that miracle you've been seeking. And so going back to her, because I like using some of the cases as examples, we had a very deep conversation about all of her choices, the supplements, the PRP, the hormone manipulation for priming, including testosterone, the stem cells, and whether she wants to try IVF or IUI with her AMH of 0.1, understanding that the cheapest, fastest, shortest way to a baby is going to be donor egg past certain age. Okay, I hope this was helpful. I celebrate with my patients the miracles that happen every day, and there's somebody out there that is right now 11 weeks pregnant at 41, and she had quite of a journey to get here, but it is possible. It's just going to take a lot longer. And like I said, it will not be for the faint of hearts, and it will be, costly because of all the interventions. Have a blessed rest of your day. If you want to reach out to me, you can do it through Messenger or the Atlanta office. And be blessed. Bye-bye.